Todd says that we need a semi-hospital mental health clinic. Todd is correct. But I don't think that a lot of people understand that we have systems in place to be just that. So let's get the board. Okay, so the idea of a semi-hospital mental health clinic is kind of based off the idea that we need levels in order to fully actually support our individuals, not just the individuals that are in crisis, but the individuals before they get to a place of crisis. So, is general self-care. Always general self-care. That's always a good place to start. However, sometimes folks need a little bit extra. So we come here to community settings. Now this is going to be school counselors, pastors that are also counselors, peer counselors that come out to the community to meet you. In Washington State, we now have peer counselors in most of our libraries, at least in King County. We're still working on it. We just got peers in Pierce County libraries, at least one. And we got Sammy in Tacoma, which is pretty cool. So the idea of community settings is that you're just going to have somebody to talk to. Somebody that's, if it's a peer, they've been there before. If it's not a peer, it could be a counselor. It could be, a drop-in. Drop-ins are good. Drop-in therapists, doctors, all of that. Those are going to be community settings, and you're going to see them maybe once a month, maybe less, maybe a few times a year. Just, hey, how you doing? Outpatient. You're going to go and you're going to go see somebody on schedule about once a month or maybe a couple of times a month. The idea is that you're actually working towards fixing and mending injuries and mental health issues. And then you have intensive outpatient. Intensive outpatient is something you're going to see often with like drug court, stuff like that, or diversion programs. Now, intensive outpatient is going to be a lot more intensive. You're going to go about 2 to 4 days a week, all the time, and you're just going to be continuously working on yourself. After intensive outpatient, we have voluntary stays. A voluntary stay is when you actually go to like a regular hospital and you're like, holy crap, I can't handle this. I just need to be by myself for a little bit. I need to be in a safe place with professionals watching over me. Not only voluntary stays at a hospital, but also a lot of places have crisis centers. Unfortunately, Pierce County, we just lost 2 of our crisis centers. They were the only crisis centers we have. We do have another place that's kind of like a crisis center, a couple of places. But this also covers places like detox, a 3-day stay in a place like Wellfound or Navos or, what have you. These are Washington places. Sorry if you're not from Washington and you don't know these hospitals. I'm sure you have your own version. So after the crisis center, if you're still having a hard time, because the crisis center is only going to be about 3 days. Same with voluntary stay. We have several different rules on this, but usually it is. Some places are a 23-hour, because if you go over that 24 hours, it's no longer just like a crisis check-in. Then you're doing a 72-hour stay. After that, involuntary hold means that you've bypassed that 72-hour and you are definitely not okay, but you also don't want to be there and they say, okay, you can't, you got to stay here. You got to stay here. Evaluation and treatment centers. Evaluation and treatment centers are often another name for involuntary centers. Usually they are just a place where somebody is being evaluated for longer term. This is usually where we see people are staying for 72 hours and then they have to go to mental health court, and then the mental health court will say, you know what, you're fine, go home. Or they'll say, we're going to have to boost it up a little bit, you're going to have to be here for 7 days. Now, if they say that you need to be there for more than 7 days, you're going to go down here to long-term hospitalization. Now, there's a lot of rules, a lot of new laws. It's a very confusing practice. However, long-term hospitalization is usually going to be more than an evaluation period. It's going to actually include treatment, constant watch, therapeutic settings, etc., etc. But a voluntary hold is going to only be like 3 days or less. Long-term hospitalization is usually going to be like several weeks, several months. Sometimes it keeps going. It goes until you are no longer in that place where you need hospitalization. And then we have what everybody actually expects from the hospitals. Civil commitment. Civil commitment is the idea that you can't take care of yourself. You are a harm to yourself or others, and therefore, and this even goes with legal, if you have already done time and you have come out of that, served your time, done your probation, and the judge says, no, this person is still a danger to themselves or others, you will also fall under this, where you will be civilly committed, and it is really hard to get out of. Now, there are a lot more steps in this, but I wanted to kind of go over these first few steps because of the fact that, like, community settings is a big, important, missing part in a lot of places. Community settings is going to be one of those things that, we talk about when we talk about mental health in schools, when we talk about mental health providers being at the actual, like, medical hospitals. It is also church. We have a lot of counseling that comes through church. We have a lot of counseling that comes through social organizations. These are all community settings, and the idea is that it's okay to ask for help, right? We talk about this all the time. It's okay to ask for help. We don't talk about where to ask for help, who to ask for help, how to ask for help, or how to self-evaluate and say, hey, crap, I need help. Community settings is where it starts. Because no one's out here, especially here in Pierce County, talking about the options you have, except for people who have already been through the system, right? You've got a friend who says, hey, I had a really hard time. I went and stayed 3 days at the crisis center over here in Parkland. That's what you're going to do. You're going to follow your friend's advice because that was a community setting. And the counselor's going to say, hey, you know what? I think you need a lot more than I can give you. I'm going to have you go over to this outpatient center. I'm going to give you a referral. You're going to talk to a counselor a couple of times. Maybe you'll talk to a therapist and get a diagnosis. Then you'll get your, medication from your primary caregiver. These are stages of need. And if we miss all of this stuff here in the middle, right? We just go from community settings where we're out here by ourselves to civil commitment because there isn't anywhere in the middle. And we have been doing this since the Kennedy administration. Sorry, but it is getting better. Every year, legislation gives us new options. You're going to see a lot of people fight it along the way, but we need it because we need every single level of care and more. There's more that I didn't list, but this was just, as needed, talking with friends, talking with counselors at church or school. Outpatient settings is being able to just talk to somebody on a schedule, etc., etc., etc. You start off, you're going, when I just need it. A couple times a week, 23 hours, 72 hours, a week long, several weeks long, a couple years. All of these things also relate to, this all relates to mental health, substance use. This relates to co-occurrence, trauma. You can actually apply this to vocational counseling. I don't know, all of this. We need as many stages as possible. But we have it. That's the problem. We just don't talk about it.